And how many clinical pathways are there in the assessment process? Like, would you look at like almost like one per body system, or is it more creative than that with a guideline for your process?
You know, it really is more creative than that, and our system is organized into many clinical pathways, about 100
Wow.
at this point. And each of those pathways is put into particular categories that have some similarity. For instance, one of the categories is neurological, and within that is what we call the sensory motor pathway, a pathway that works on how the mind-body perceives sensation and how it sends the motor response signal to the glands and to the muscles. And there are perhaps a half a dozen, maybe 8 other pathways within that neurological group. There's an immunological group that deals with allergy, that deals with infection, that deals with how white blood cells are trained. So we have this kind of a pyramid. We call it a pathway pyramid, and we go from the general to the more specific. So we look at these categories to see, do we need to work in the immunological area, the neurological area, the emotional area? And within that group, then, we find a particular pathway that the mind-body recognizes to be the highest priority, the most helpful. Mm. And so our session is a matter of applying one pathway after another, having previously determined by way of muscle response testing that which one the mind-body recognizes would be the most efficient and helpful.
Mm-hmm. You mentioned something else. We've been really focusing on a lot of the physical issues that someone might have, allergies or pain or that mm-hmm. sort of thing. But you did just mention an emotional priority that your body might have.
Oh, absolutely, absolutely. And that is, I'll tell you, that is so profound and it's so important. And I'll tell you a little bit about how we look at emotion, because most of us are kind of blinded by the spectacle of experiencing emotion, and our thoughts about it are really thoughts about how the emotion seems to us or feels to us, and some of them are scary and some of them are fun and some mm-hmm. of them we like and some of them we don't like, but seldom do we step back and ask ourselves, what is this emotion for? It's not just to scare you or tickle you. It must have some survival value. It must have some value for the mind-body as a whole. And my view in neuromodulation technique is that emotion is really the operating tone of the system. It's the operational mode of the system. And what I mean by that is, think about, for instance, a patient who has allergy or chemical hypersensitivity. At some level, it's kind of like the immune system is in a state of paranoia and fear, and it's responding and reacting to things that it doesn't need to respond and react to.
Hi there, my name is Nina Wallinder, and I wanted to talk to you about Layers of Health. Layers of Health is a free online community dedicated to investigating holistic and alternative health options. These options can include physical health, mental and emotional health, business health, as well as your spiritual health. So you can join me as I discuss your health concerns with various experts, mentors, and leaders in their fields. And these interviews are offered for free live, as well as during special encore presentations. But if you find one that is particularly interesting to you, you can also purchase it. So you can join me at www.layersofhealth.com, and I'll see you on the calls.